Okay, so good morning, everyone. Welcome to Wellness Wednesday. And John 10:10 said, "The thief cometh not but to steal and to kill and to destroy, but I am come that they might have life and that they might have it more abundantly." So we're gonna talk about men's health this month. The disclaimer: this presentation is for education purposes and is not meant to be replace the advice of your medical professional. It is not to be construed as diagnosis, prescription, or treatment of disease. God is responsible for the result of obedience of his lifestyle plan. The receiver or user of this information must assume all risk personally for the use or misuse of these information. Therefore, this disclaimer serves as notice to the receiver that he or she is free to seek medical attention, advice, treatment, and diagnosis from a licensed medical professional. Okay, so we're gonna talk about prostate today, and it's a part of the male reproductive system. So if you look on your screen, you'd see when I highlight certain parts of the body. So that's the whole, everything here is the male reproductive system. So here, this is the penis. And then we have the urethra. So the urethra is this tube that, if you look at my pointer, this tube run all the way down from the bladder. So let me just fill this in. Okay, so here is the bladder, number 5, that's the bladder. So there's a tube run from the bladder all the way down. It passes through the prostate, this little knot around here, and it goes all the way down to the penis, okay, and comes out when you want to wee. So that's the urethra, okay? Here is the number 3, that's the testicles in here, and that's the testicle bag here that you call the scrotum, okay? If you look at the bladder again, on the right side of the bladder, you can see another tube coming down and filters into the urethra, okay? So that tube, that's where the semen come from, and this is called the seminal vesicle, okay? So the urethra is used for 2 purposes: to pass urine from the bladder and to pass the semen from the seminal vesicle. And then behind that is the rectum, okay? And below the rectum now, it's your anus. So this other photograph shows you the prostate properly, okay? The prostate gland. So the prostate gland is the yellow bit here, that yellow little knot on both sides of the urethra. So the bladder at the top again, and to the left this time, that's the seminal vesicle where the sperms come from. And then the bladder here, the urethra at the base of the bladder that passes your urine. So the prostate is a small gland found in the male reproductive system. It is situated in front of the rectum, as I've just shown you. below the bladder and surrounds the urethra. So the urethra passes through the prostate. The tube which the urethra is the tube which the urine flows from the body. So it flows from the bladder out of the body into the penis and out in the toilet or wherever you go and wee. In a healthy adult, the prostate weighs about 20 to 25 grams. It is approximately 4 centimeters wide and 3 centimeters high and 2 centimeters in thickness. And it is the size of a chestnut. So if you could figure, you know, in your mind what a chestnut looks like, that should be the size of the prostate. The main function of the prostate is to secrete part of the seminal fluid that comes with the sperm to form semen. The prostate gland is relatively undeveloped in young male, but when they reach to puberty age, the prostate starts growing. The duct is there, so it starts growing now into prostate. That's when the young boys, they became of puberty age and they start making testosterone, okay? And by that time, we know they could start making children. So these are the things we have to tell our young boys as well, because they might go out there and play around and then next thing, you know, children is involved. So when they become puberty, this explode, there's an explosion. So the number of the prostatic follicles, it increases, okay? And which it triggers off the production of semen. Prostate size remain the same until around 40 years old. The size can simply be described as small, medium, or big. The urologist uses volume rather than weight to characterize your prostate. The measurement is ascertained by using ultrasound. And as I said, it's a shape as a chestnut. And the sizes varies from person to person and from age to age. A small prostate would hold between 30 to 40 mils of fluid, and also weighs between 20 grams and 70 grams. A medium prostate has a volume of between 40 and 80 mils and weighs between 20 and 125 grams. And a large prostate have about 40 to 100 mils and weighs between 40 to 125 grams. At the age of 40, prostate glands begins to grow. With a benign prostatic hyperplasia, and this is a mild disease of the prostate glands, okay? So it would increase about 4 to 5 times in size. So we have 3 types of diseases of the prostate. So there's the prostatitis, which is infection of the prostate. Then we have the prostate adenoma, which is also called benign prostatic hyperplasia, which we say BPH. That's the abbreviation for it. And it's when the prostate is inflamed. And this is when men say they have enlarged prostate. And we have the dreaded part, which is other disease, which is called prostate cancer. And this is the reproduction of abnormal cell into malignant cells. So on the screen, you can see what the normal prostate is on the left, And on the right, this is what the prostatitis looks like. So here you see the prostate, normal shape, and then on the other side, you see where it's inflamed. Sorry. Okay, so this occurs between men between their 30s and 50s. They start experiencing problems with their prostate, you know. So we advise, you know, men to start checking their prostate from 35 to 40 years old. Yeah. So these are linked with urinal and genital tract infections. And also, you would notice when these problems are happening. Most of the symptoms would be fever. You would have burning sensation when you go to the toilet, and you would go to the toilet and you would wee a little bit, and then you would feel like you're finished, but you know, you would keep going constantly, very often, because your bladder is not empty properly. Because if you see here where these two arrows are, that's when the prostate is inflamed, then it press against the urethra, and so it prevents all the urine from draining from your bowel, from your bladder. So when the prostate inflames, it presses against the urethra, and then it prevents the even flow or free flow of the urine from the bladder. Okay, so that's how you feel like you go to the toilet and you wee, but in 3 minutes again or 5 minutes again, you want to go again. You would also experience lower abdominal pain because it's an infection. You will have lower abdominal pain as well. And they can treat this, the conventional ways to treat with antibiotics. Okay. Then we have the prostate adenoma, which is the BPH, the benign prostatic hyperplasia, and this is the enlarged prostate. Okay, so we can see here the normal prostate again, and you see how the urethra is wide and the urine could flow. And then on the other side, we could see how it's enlarged. So it's again pressing against the urethra. So it closes the urethra so the urine can't come out properly. So in the bladder here, all this urine is stagnated urine there. So you go to the toilet again and you have the same problem as the inflamed one. You would have the same problem. You would we very often, you keep going and still your bladder won't be empty. So some of the symptoms would be urinary leakage. You know, sometimes you walk the street and you see some men, the front of their trousers is wet. So that's one of the problem. That's one of the leakage. That's when they have leakage of urine. So then you would know they have a problem with their prostate. And they would wee frequently, go to the toilet frequently because they can't empty the bowel, the bladder completely. And also this can cause sexual dysfunction as well. Overall, 10% of men would experience this problem, okay? Complications would be retention of urine. So the urine would be in your bladder and it will become stagnant. Urinary infection and renal failure. So if you can't empty your bowel properly, it's impacting on your kidneys, and then you start having, you know, renal failure, which is kidney diseases. Okay, and kidney disease have different stages. So the first thing, they would intervene medically with treatment to see if there's something they can do. And if the treatment doesn't work, they will give you tablets. And if it doesn't work, then they would have surgery. You would have surgery. And then we have the dreaded prostate cancer. So with the cancer now, you can see on the left, you can see the normal prostate on the left, and the prostate cancer on the left. So you can see here where the urethra is almost closed now, and this here, like it's a growth. Okay, that's the abnormal cells. Now the normal cells turn into abnormal cells, malignant cells. Okay, and this is what we call cancer. And this is mostly common in men, Hispanic men, Black men, you know. So we need to advise our men, male in our family, you know, in our relationships, our husbands, our fiancés, to go and check their prostate. Some of the tests that they do for prostate problems to diagnose it would be a PSA test, and they can also do a rectal test. And we know that our Black men, they are so proud and that they don't want nobody to touch their bum. So they would rather die, wait till you get late, so too late. So this is how the urologist would check your prostate. He would go from your anus at the back, and then you see where the finger is, and that's your prostate there. He will touch the prostate to find, you know, if it's swollen or if it's enlarged, and then they would do ultrasound to finalize if it's really prostate cancer you have. So this test alone and the PSA test where they take some blood. So the PSA test and the rectal examination test is not the conclusion to say that you've got prostate cancer. They have to do an ultrasound as well that would, you know, finalize that you've got prostate cancer. I'm aware of the time, so I'm going to stop here now. And next week, by God's grace, we'll continue this presentation. Okay, so I will just pray to close and then hand over to the next team because we only have 2 minutes.